Let's now go on Facebook Live because former President John Mahama is addressing people on how some of the health facilities he started have been abandoned.
There were a number of these health facilities which were not completed by the time we left office and only required a little more effort to complete. The natural expectation, therefore, was that the succeeding government will swing into action and have them completed and press on to make even further investments in the sector to make the goal of health for all a reality sooner than later. It was also thought that those that had just been completed at the time will be operationalized for use by the Ghanaian public, in whose name and for whose benefit the facilities were established in the first place. Governments, citing very strange reasons, differed in the operationalization of even those hospitals that were completed. The government also failed or refused to complete several key projects that we undertook, not just in the health sector, but also in the roads and education sectors, among others. A clear case of putting politics before the people. A classic case in point is the University of Ghana Medical Center, which I had the privilege of inaugurating in December 2016, and which was ready for use at the time. After an avoidable but protracted tussle with the University of Ghana authority over the management of the facility and misleading claims by the health minister that the facility did not have a standby power system, it had to take a one-man demonstration and the COVID-19 pandemic for only parts of the hospital to be opened to treat patients. This is a 650-bed Tier 4 hospital that can render cutting-edge services to our people. Today, that facility's ICU, intensive care unit, which was left abandoned for more than 3 years, is saving lives, serving the very purpose for which it was built. Because of the advanced nature of the equipment and facilities in the University of Ghana Medical Center, health staff were sent to Israel for specialized training to come and operate that hospital. These staff have still not been put to work and are currently dispersed all across our health system. The training they received has unfortunately been underutilized. Similar delays have been experienced with the municipal hospital at Ofankor and the Kaswa Polyclinic, both of which we constructed as part of the community development component of the Awoshi-Pokwasi Road and the Kaswa interchange projects. 2 years after they were completed, it had to take intense media and public pressure to get them opened. All this was at a time when the no-bed syndrome had resulted in a sad situation where patients in need of urgent medical attention were turned away from hospitals because of congestion, resulting sometimes in avoidable deaths. Ghanaians died when hospitals completed and ready with a combined capacity of 900 beds had been left standing idle. But for the deliberate slowdown of operationalization of the University of Ghana Medical Center and the Bank Hospital, the unacceptable no-bed syndrome would not have claimed these precious lives. Talking about the Bank Hospital, the rather curious case of that hospital and the International Maritime Hospital cannot escape attention. These are ultra-modern, world-class hospitals built with public funds and yet have either remained shut or are underutilized. Particularly worrying is the abandonment of some major health facilities that had reached an advanced stage of completion by the time we left office. I refer specifically to the NMS project, under which 7 fully equipped 120-bed district hospitals with staff accommodation commenced in 2013 at Dodowa, Kumawu, Fomena, and Abetifi. By early 2016, the Dodowa Hospital had been completed and commissioned into use, while those at Kumawu, Abetifi, and Fomena had reached various advanced stages of construction by the time I left office in January 2017. Whatever the challenges with these projects, they should not have been left abandoned and left at the mercy of invading weeds and reptiles, and in some cases, been affected by bushfires. Chiefs, queen mothers, and residents of these communities have on many occasions had to beg and appeal to government to allow the contractors to return and resume work, but all to no avail. And what has been the cause of the abandonment and stoppage of work, despite the availability of funds for the continuation and completion? Fruitless and malice-driven value for money audits that yielded virtually nothing. Another case in point is the almost 1 year delay of the Eurojet, the Invest Hospital projects. These projects involved hospitals in Tepa, Nsoko, Twifopraso, Salaga, Konongo, Kumasi Regional Hospital at Sewa, and a new military hospital at Afari in the Ashanti region. For 1 year after the new government came into office, these projects were stalled because the project managers were asked to pay duties and taxes on material and equipment at the ports, even though they had a valid exemption granted by the Parliament of Ghana. This situation robbed the people of Ghana of the timely opportunity to access quality health care, which would have been offered in the catchment areas these facilities were to cover. But for the inexplicable failure to continue these projects, we would have been in a much better position to tackle this COVID-19 pandemic across the country with a more robust health system. In addition to more health workers being employed, they would also have had a more congenial environment to offer their critical services, and our people would have had a more dignifying place to seek health care. While even more investment is required to augment the existing health infrastructure, it is important that the plan to do so is credible and clearly thought through. What we should avoid is knee-jerk promises that appear reactive rather than the product of critical thinking and a well-coordinated response to an existing or emerging problem. Ladies and gentlemen, the reaction of the public to the President's promise to construct 94 new hospitals in 1 year is understandable, considering his rather tall list of unfulfilled or poorly implemented promises from yesteryears. I believe in a well thought out and forward-looking agenda, which ensures further strategic investments in our health sector to meet contemporary and future challenges. This must take into consideration the grave threats posed by global pandemics like COVID-19, SARS, MERS, Ebola, amongst others. It is in furtherance of this vision that I announced on my visit to the Western North and Bono East regions in July 2019 that if elected, God willing, in December 2020, I'll establish a regional hospital in each of the 6 newly created regions. I also indicated that I'll ensure the provision of a modern health facility in each district that currently does not have one, as part of my Health for All agenda. All districts would receive a modern health facility. These facilities will range from polyclinics to district hospitals. Proper planning requires that we take into consideration location, demography, population, and health needs of the area before siting a health facility. There are, for instance, currently districts with well-functioning hospitals owned by faith-based organizations. In such cases, we will partner with these organizations to upgrade their hospitals, to improve their services, rather than duplicate it with another public hospital in the same district. And in districts where there already exists a polyclinic or health center that is overstretched by population growth, we will upgrade them to the status of hospitals by adding infrastructure and equipment. I reiterated these in my Facebook Live session late last year. Furthermore, I re-emphasized this commitment in 2 public engagements since the outbreak of the COVID-19 in Ghana. The first was when I donated PPEs and other medical supplies to several hospitals across the country in a bid to save health workers from being infected.
The former President Mahama, in an address on Facebook, focusing on abandoned health facilities, which he says would have complemented government's efforts in the fight against COVID-19. We're still live.